Today what I'm going to do is actually use the dummy site that will allow us to go in and not break anybody's confidentiality. So I'm going to go in and paste that. Notice the difference in these two addresses. This is actually the dummy site. I just wanted to show you both. I'm going to log in again, and what I want to do is go in, click on IEP, head back to Allen. And the second part of what I wanted to show you was that we can actually create other releases, forms, reports using this system. Head back to the area Forms, and if you'll notice, there are two forms here that I had created previously. So I want to take you through and show you these forms. In order to add one, you're going to choose a form. We're going to add another health release and click on that. A health release is for the purpose of releasing records. That will allow you to get medical records. It is one release that releases from that physician to you or from that office to you. It does not allow multiple sharing or exchange. And when we get in here, I'll show you what that looks like. It's a little different. For the end date, what we want to put down is a year from the date that we currently are getting the signature. So that would be correct. For the name, we're going to go in, and sometimes things are stored on here. For purposes of this, let's do Dr. Sheets. Pulmonology. Agency would be, in this case, Heartland, Area Education Agency. That's who is requesting this. The district is not easy. There are a lot of districts in here. It's all the ones in Iowa. So you do have to go through. Since we're working in Dallas Center Grimes for the purpose of this tutorial, I'm going to click on them, and then it's automatically populated. I'm going to type in my name, and then I'm going to type in the district nurse. What this does then is automatically fills in the address based on what we selected from a previous screen. This will allow part of the address to come in, but not all of it. And I want to show you that in a second here. Let's go back then and figure out the date we want this to start. If it's a specialist like this, I would usually ask the family, when did you first see this doctor? Or maybe there's a particular test I'm after, and so I might choose that date just to make sure that encompasses it. If I'm looking for pediatrician records, sometimes on elementary kids, I'll actually put their birth date down if I want to get a nice assortment of records to understand what they're being seen for. It's really up to you what you put down. And then know that the end date is always going to be a year from the date that you get the release signed. Obviously, I check everything here. If there's something special I want, like for instance, I might want recommendations for PE. I can type that in, and that's just an example. But if there's something that's a little different that you want, oftentimes, especially for students who have a brain injury, I'll want an MRI report, or maybe I'll just want a discharge summary if they've been hospitalized. If it's something special, type it in. If you want anything having to do with attention deficit disorder or mental health, you do have to check this separately. Click Save, and then it should be automatically ready to go. In order to see what you have put in, you actually have to hit the print button. So once you hit print, it will ask you what you want. We want the form itself. If it's blank, it truly will give you a blank release, so you'll have to hand fill in everything. Go ahead and print it. I want to print it as a PDF just so that we can see what this looks like. Okay, there's our release. As you can see, it has all the information we need on here. This was the first release that I completed for Dr. Spencer. We saw that one listed on there. And it will also print the one that I just created for Dr. Sheets. I wanted you to see that both of those are on there. And then make sure that this date is a year from the date that you're signing it, as is this one, and you're good to go. You've printed a release. Once you're done printing, go ahead and close out this box. And I'm going to show you one other release type, which is the exchange of information. Exchange of information is a little different in that it allows you to select what it is you want to be able to do. The purpose of this can be to collaborate, to exchange information, to support the parent, whatever it is that you want the purpose of, list it clearly on here. So I've listed there the purpose is to coordinate care between home and school. Obviously, we want all the same things that we wanted before. Maybe this time we'll include some mental health. And then this allows you to be a little picky about what's allowed to be exchanged. So in this case, we always go for more if we can, although if it comes to getting restrictions or nothing, I do choose restrictions. This would be where I would fill in my name, address, lookup, and then down here I'm going to add various providers, and I can click as many as I need to complete this form. And then I'm going to click Save, and then this form I would print out as well. Those are the two basic forms. Other things that you may use once in a while, and I'm not saying that you're going to create these, but I'm saying you might want to go back and read some of these. Anytime that there's a prior written notice, that means that there were decisions made whereby the parent needed to receive something in writing. So let's say we added health services, or it was an initial and decided to staff the student in special education. You're going to find summaries of what happened at meetings under the prior written notice. Other things you might find are like if there's a behavior intervention plan for a student. Maybe you have a student that has some challenges they're presenting in the health office, and you'd like to just read the behavior plan to see if there's a way that perhaps you could tap into some of the things they're doing in other places in order to make the health office visit a little more productive. That's another thing. Also, some of these other things really aren't as important for us to know, like the meeting notice. Sometimes it's good to see who's listed on a meeting notice, who all's coming. If you're not listed on the meeting notice, be sure and talk to the teacher. The special ed teacher will be the one who issues that. The other thing I would like to show you is under student list. As we look at student list, we can also see meeting dates, reevals, when the last meeting was, all kinds of good information on this as well. The final thing I want to show you is actually on this ideainformation.org site. If you go into this site, this is the most current information on the IEP, and this is real and this is live. So you can go in here and read anything you want to know about special ed. You can also go in and find some guidance for IEPs. The manuals are in here as well if you want to read that. There are some Medicaid resources. So this is a good site to bookmark and then go back and read. Here's the LEA Provider Manual, which is the Medicaid manual that districts operate under. The other thing I want to show you is that version 4 Web IEP is now gone. We can't access it. It doesn't exist anymore. So just wanted to show you that, and to let you know that if you want, you can go into the real site, which is this address up here, log in. And then once you get logged in, there is a section up here that has reports. If you click on that, it will allow you to go in and print out all the Medicaid information we used to be able to get on the 4 version. That's closed as of this year. So you can go in and click on those Medicaid eligibility. Once you do that and you click on it, once you get ready to do that, you can click on Medicaid eligibility, and then it will download a report for you that has all the information that you need in order to fill out your Medicaid information. Once you're done with the program, make sure you log off. If you have any questions whatsoever about IEPs, make sure you talk to your AEA staff. They'll be able to answer your questions, as will any of the regional secretaries. They are very knowledgeable about the system and they're very willing to help. Thank you, and I hope this has been helpful.